Hi everyone. We are live. It's good to see you. I'm Dr. Funke Afolabi Brown, and I am here for another episode of Candid Conversations. I'm just going to wait for a couple of our friends to join and then we'll get started. I have a really special guest that'll be joining us today, Dr. Yel'Ora, and we're going to be talking about shift work. As we know, everybody has some point in their lives may need to work at a time that may not necessarily be ideal if you were able to have a choice. And we have shift workers that we do need them. We need them a lot. And so hi, beautiful in Jesus. And so we're going to really be talking about shift work, disorders related to shift work. We're going to be talking about the impact of shift work on our health, as well as how to thrive. My guest, Dusk to Dawn, looks like she's here. We could get started. I believe she should be joining us shortly. So if you're here on, hi, how are you? Good to see you.
Good to see you too. How are you?
Good. I was just giving our friends a little taste of the exciting conversation that's to come. But I didn't spill any beans at all. I just was whetting their appetite. And so if you're on here live, let us know. I'm waving as you come in. I try to wave, but say hi. And then we'll get started. Once again, I am Dr. Funke Afolabi Brown. I am the founder of Restful Sleep MD, and I am really thrilled to have my friend here, Dr. Yel'Ora, and we'll be talking about all things shift work. She's like the shift work, whisperer, I guess.
So the night whisperer.
The night whisperer. Really good to have you. Do you want to introduce yourself?
So my name is Dr. Yel'Ora. That is my business. That's my my DBA. I do business as Dr. Yel'Ora. But my birth name is Chinyelu Oraedu, and I always like to kind of chip it in that Yel'Ora is actually the last part of Chinyelu, which is the dusk, and the beginning part of my last name Oraedu, which is the dawn. So that is dusk to dawn. That's how I coined it. So it's all like everything is geared towards night shift work. Yeah.
Wow. I love that. Then how did you come about just this work you do? Like, can you tell us a little bit? Just give us a little bit of perspective. Like, why are you so passionate about shift work and its effects? And now you've made it a mission to help others who are shift workers.
So this is a very it's a very lengthy explanation. It's like a whole discussion on by itself. But I started working nights pretty much because honestly I couldn't find a job. I just couldn't find a job because I started looking pretty late. I mean, if you understand the residency cycle, towards the end of your residency, which usually ends in June, most people by March, April, even by February, they've signed a contract. So I had my daughter in March, towards the end of March, actually the day after I took USMLE Step 3. So I took Step 3 on a Friday. I had a cesarean section on Saturday, and I had my daughter. So everything was just happening at the same time, and I just didn't start looking for a job on time. So by the time I started, the recruiter said, "Oh, there's a night job in Connecticut, but I live in Long Island." I said, "I live in New York." He said, "Why don't you just go check it out?" I went, I checked it out, and I love Stanford. I live in, I work at Stanford, Connecticut, and that's pretty much how I started, working nights, and I was supposed to do it for like 2 years, and I didn't. I was going to go for fellowship. I wanted to do hematology, oncology, but I just started doing it. And the more I did it and I struggled, I decided I was going to make it my mission to help people thrive. Yeah.
That's amazing. I would love for us to talk a little bit about those struggles. I think one of the things that really fascinates me, especially as women, as physicians, or, women who are really making some of the things that were their pain becoming their purpose pretty much. And it sounds like that's what you did. And I would love to hear more about what those struggles are. But first, maybe we could give some perspective. Like, what is shift work? What does it mean to be a shift worker? I know you mentioned night shift. So can you just give us a little bit of a definition to start with?
Sure. So, when you hear
Mm.
shift work is a terminology that pretty much, I mean, you can define it in like two ways. It means, people, when you work, non-standard hours, which is like people who work outside of the 9 a.m. to 5 p.m. schedule. And there's another definition that actually, states that shift work refers to, when you have a group of people who rotate in the same job at different times. So with that definition, then you're going to say that shift work, you can have like the morning shift, then you have, which is the first shift, and then you have the swing shift, which is the second shift, and of course the third shift is the night shift or the graveyard shift. So that's and they do overlap. Some of them, most times, the morning shift is 9 to 5, and then you have, the swing usually is for like about 4 p.m. to like midnight, and in some jobs they consider night shift from midnight to 5 a.m. or 6 a.m. But in healthcare, we do longer hours. So you're going to get night shift, maybe spanning from either 11 p.m. to 7 or 6 p.m. to 6 a.m. or 7 p.m. to 7 a.m. and 8 a.m. They're different shifts, but it's a whole range. Some of them overlap.
Yeah. And I think just for the sake of, context right now, I would say we'll really be talking more about that third shift, that night shift worker. Like either you're in the ER or you're a hospitalist or you're a nurse or, you are. I mean, there's so many occupations where you may be working that night shift, but the first shift, the swing shift, of course, there's struggles with that. But really, I think I want us to own in on, the night shift, that graveyard shift. Why is it even called graveyard? That just sounds so depressing.
I know it's called a graveyard. I guess, for people in jobs where people do it from midnight to 5 a.m. And I guess there's a movie, I think there's a movie called The Night Shifters, they were like, morgue workers or something like that.
Got it.
So, I mean, there's actually a new show on Netflix, I think called The Night Shift or something like that. So there's a lot of, people that are really being a little bit more aware of night shift and the challenges that they face, as regards to health and wellness. So, but graveyard is not really that common in healthcare. I mean, I've never heard anybody call it graveyard, but I guess other professions, maybe they use it. I don't know.
Yeah. So what are those health effects? Why are we even having this conversation? Why is it such a huge issue? Can you just give us a rundown of what are the concerns and things like that? And what are some of your struggles when you were initially starting?
So, the reason why I started this to talk about night shift is, COVID-19, the pandemic changed a lot of things. It actually helped me to kind of reset my health. Things changed. My children weren't that busy. School was remote, and I could focus on myself. And that was when Dr. Yel'Ora was actually born. But in terms of the health effects of night shift work, we got to go back to I call it the do-re-mi of the whole problem, which is the disruption in your circadian rhythm. That is, the circadian rhythm is the 24-hour cycle, that controls, a lot of processes. And I guess the most important one is the sleep-wake cycle. And of course, when you work nights, unfortunately, it's unnatural because, the whole effect of light and wakefulness, and when it's nighttime, the gland in your brain starts to secrete melatonin that tells you it's time to wrap up. It's, things start to slow down, all the biological processes. unfortunately, when you're a night shift worker, that is when your day is kicking off.
Yeah.
So, I mean, a lot of the health effects, ill effect of,
Dr.
health.
Una. Sorry, I just interrupted you. I thought my
Hey,
thoughts come up. Hi, Dr. Una.
hey, Dr. Una. So,
Yeah.
some of the health effects that, night shift workers face is as a result of this disruption in their circadian rhythm, right?
Mm-hmm.
So, melatonin is not secreted. Melatonin is such an important hormone.
Yeah.
It has anti-inflammatory effects. It has
Mm.
antioxidant, oxidative effects, even anti-cancer effects, where
Yeah.
it's been studied now. So the spectrum of health issues, be it cancer, type 2 diabetes,
Yeah.
heart disease, actually, as a matter of fact, there's increased risk of cognitive, impairment.
Yeah.
It's been due to the, lack of, rapid eye movement sleep that we don't get to that level, because at night you're working instead of sleeping.
Yeah.
And even when you sleep during the day, you don't really, sleep may not be restorative and,
Yeah.
refreshing enough. So these are part of the issues that contribute to the health effects, that night shift workers face. It's tied to the disruption in their circadian rhythm.
Yeah.
So that is the big one. That is the most important takeaway.
Mm-hmm.
Anybody who works nights need to understand. But
Yeah.
I mean, but I have to also, mention that this risk factors, it puts them at increased risk. And where I come in is that I want people to be aware of those risks,
Mm-hmm.
so that they can take the measures to prevent them and
Yeah.
minimize. And of course,
Mm-hmm.
we're also going to get into so many other questions I know that you have. Yeah.
Yeah, no, and thanks for breaking that down, really, because it's not, it's not what we would call physiological when you're awake, when your body, your circadian rhythm is actually primed for sleep. And so thank you for taking us through that, because it's that disruption, in addition to the sleep-wake cycle. The circadian rhythm also controls so many things: our metabolism, blood pressure regulation, so many hormones. And then we're now getting all the downstream effects. And also thank you for mentioning the cancer. I mean, that sounds scary. I mean, at some point there was a point where people were, saying, I think it was the International Association of Research,
Yeah.
Cancer
Yeah. On
Research, or something
cancers.
like that.
Yeah.
Yeah, where they said shift work is a potential carcinogen. I mean, that sounds really scary. And you and I have had conversations in the past. Sometimes, I mean, ideally, should anybody work shifts? If it was a perfect world, no, but we do need shift workers. We do need people to be in the ER. We do need people to fly. We do need, we need that. We
Yeah.
need engineers. So that's not necessarily the solution. I mean, of course, if it's possible to get a job where you have a normal a normal shift, then that would be perfect. But we do need that. We need that system in place. So maybe we could now delve into, what would you say, to that shift worker who quitting their job and switching shifts is not an option? How do you really guide people through this process where they're like, you know what, I'm obese, I'm struggling with obesity, I'm struggling with hypertension, I have type 2 diabetes, it's hard for me to manage. Now I have insomnia, I'm anxious and depressed, because you can have all that in just even one person, right?
Yeah.
So walk us through just what are some of the recommendations, and how do you help them sort of still thrive even in that season where they do have to work shifts?
So, the reason why I started this, first, from my personal experience, having gone through it for so long, and, while raising my children, but also that if you watch the economy, if you watch, how the world economy is progressing, we live in a 2-4-7 economy. I tell my kids, when you order a toy or whatever, my son wants some AirPods, the Apple AirPods and all that. He wants it, and he wants it now. So I told him, if you order it on Amazon today, this evening, and if it comes to our doorstep tomorrow morning, it's because somebody was working overnight. Someone was working overnight in the Amazon warehouse, packing your stuff. That is how 2-4-7 economy is. And that with COVID, so many things changed. People started switching profession. People were a lot of people getting into healthcare.
Yeah.
If you look at the numbers, it's really staggering. And a lot of people who are going to switch over are going to maintain their jobs, probably work at night and go to school during the day. Yeah. So this is actually the main focus why I started to do this, because people work nights for a reason. Yeah. And when you have that reason, that clear reason why you work night, it drives you and it keeps you focused. And I am doing this so that I can kind of bridge that gap between the night shift worker, the employer, and their healthcare provider, right? Yeah. So going back to how I help them to thrive, night shift workers. I mean, first of all, part of the problem night shift workers face, most of their health problems is as a result of poor sleep. Yeah. Sleep is a big problem because sleep triggers obesity. And now even when I talk about the satiety hormones, ghrelin and leptin, it's tied to that. When you don't sleep well, your appetite is voracious. You have a very big appetite and you crave the bad food. You crave the salty, the sweet, the fatty, all those things. So that promotes obesity. When you get into the obesity, then diabetes and everything now follows. So my focus is on night shift workers. Food is a big trigger. I mean, I was at a hospital that had a cafeteria that closed at 2 p.m. I'm like, how are you gonna close at 2 p.m.? You have people working. So my role as somebody who is a night shift coach is to focus on food. The night shift worker, be mindful of what you eat, how you eat, what you eat, when you eat. Mindful also of stress. How do you manage your stress? How do you manage your sleep? Keeping a sleep diary. When we get into the whole sleep health and sleep hygiene, we're going to talk more about that. But sleep, most people should get, adults, 7 to 9 hours. The studies show that people who work nights are actually behind from upwards of like an hour to like 4 hours. Yeah. They get less sleep than day shift workers. So that is a problem. You got to be mindful of that, right? So I do emphasize on sleep in my program. And also, of course, I emphasize on other, the lack of sunlight, the fact that you just work at night, your vitamin D level. Vitamin D is a strong antioxidant. Yeah. So working nights and not being on top of your vitamin D is you have to make sure that it's well repleted, that, you eat foods that are, well fortified, so that, you keep your vitamin D levels up. In addition to that, exercise, I'm just going to put this in because some people don't know that. Do you know that when you exercise in the fasting state, as in, if you're able to like work overnight and you can exercise, whether you exercise 10 minutes, 20 minutes, you actually burn more fat. Because when you work overnight in a fasting state, if you just able to like maintain some hours of fasting and staying away from high calorie, your body is going to burn fat because there's no glucose because of the fasting. So that is something that night shift workers have that probably somebody who works days may not be able to accomplish, unless if you work out first thing in the morning upon awakening, right? So these are like some of the tips that I have that I share with people in my group and the night people that I coach, and I just I give them tips to minimize. My role is to minimize, not eliminate. It's to minimize, and also to encourage you to have real conversation, because I think at some point people should stop working nights. When the reason your why, when your why no longer exists, or when your why, or for some reason you can switch things around due to health issues, I think you should stop working at night. So that's why I think that's my role. And
I love this. They're just I'm taking notes here because there's so many gems. So from here I've seen about 4 things, almost like 4 pillars of what you talked about. One is, or 5. So of course the first thing is sleep is the foundation, right? I'm a little bit biased, but I do see a comment here, sleeping anywhere from 4 to 5 hours. Imagine doing that on a on a long-term basis. That definitely has its detriments. But being conscious of that, and I've had a few conversations in the past on how to optimize sleep, when you're a night shift worker, and we could just go through it briefly when after this, but really prioritizing sleep the best way you can when you're when you're working night shifts, knowing that you're almost like your entire system is against you, because all the wakefulness promoting hormones are higher when you're supposed to be sleeping. So there's strategies we could talk about. Um, and then the other thing is what you talked about, being mindful about how you eat, what you eat, and when you eat. And I think that is so critical, because a lot of people are not as aware. Because you're right, even when I was in training and I had to do a few night shifts, there was either pizza or candy, or, of course, you're thinking of things that could give you quick
Yeah.
glucose, especially if you're busy,
Yeah.
but it's so detrimental to your system. And during that time, like you mentioned the hormones that are your satiety or your fullness hormones and your organ hormones are flipped. So you're craving those things and they're readily available. There's usually not a salad bar open on
That's
night
true.
shift, right?
That
So,
is true.
and that is so important. So tell us a little bit, what are strategies? Because yes, there's that craving, right? You're right. They've not slept, they're hungry. What are strategies that you would recommend? Like, should you try to eat before you come on to your night shift? Should you eat right after? Should you stay fasting? What do you usually work towards?
The reason why I started doing, this night shift thing is
Yeah.
that, there's so many tips
Mm,
out there, but are
yeah.
they really practical? Are they
Yeah.
practical? Can people adhere to it? It's just like
Yeah.
when we started treating diabetes and we said, oh, don't eat carbs.
Yeah.
Of course,
It's not
people,
practical.
diabetics eat
Yeah.
carbs, but we just, emphasize whole grains.
Yeah.
You just don't eat simple sugars, stuff like that. So,
Mm-hmm.
so when it comes to, food for people that
Yeah.
work nights, and because night shift is so, the range is so, kind of stretched out
Yeah.
from 6 p.m. all the way to 6 a.m. or to 8 a.m. and
Yeah.
all that. I do encourage people, and this is what, some nutritionists, recommend, when you get home in the morning, you have a small meal, something healthy,
Mm-hmm.
whether it's
Mm-hmm.
oatmeal. I mean, like I eat, like, the rolled oats. I don't eat
Mm-hmm.
the instant one. I don't, because it's refined. So
Yeah.
it's kind of processed. So it's not really like, whole grain. So I eat the rolled oats, and then you can sweeten it with whatever you like. But I use fruits, but I don't eat
Mm-hmm.
sugar. So you eat like something light, but enough for you to have the energy to sleep.
Mm.
Maybe like a Greek yogurt. And
Yeah.
and I guess part of my, my program is the whole concept of caloric cycling,
Yeah.
whereby you don't eat the same calories every day,
Mm-hmm.
especially when you're working nights. Because, I like to exercise, but I know it's difficult for a night shift worker to exercise. I know it's difficult. This is why I promote, I encourage,
Mm-hmm.
I talk about the, advantage of working out in the fasting state. So for those that may not be able to exercise, caloric cycling is a way that you can switch the calories you eat on the night you work versus on the days you don't work, that kind of thing. And
Mm-hmm.
then when you work overnight, you try to, because think about it, melatonin gets secreted, right?
Yeah.
It tells your body it's time to sleep. Everything starts slowing down.
Mm-hmm.
Your GI slows down. Your insulin, and that's part of the reason why eating late at night, you get, high sugar,
Yeah.
spikes in your sugar that promote
Mm-hmm.
diabetes, because
Absolutely.
everything is slowing down. So you find out that when you eat all those heavy carbs, and I love
Mm.
my nurses, shout out to all the nurses I work with. But when we have those potluck at night, when I come around and I see the potluck with spaghetti and meatballs and the pizza, and
Mm.
I'm like, at night, we can't process this. Your
Yeah.
body doesn't. So I do encourage low carb,
Mm.
low carb at night, calorie
Yeah.
restriction, lots of veggies. What you need to do is to trick your body into that sense, that the feeling like you're asleep, but you're actually awake,
Mm.
in the
Mm.
sense that, and what I'm saying is very scientific.
Yeah.
There are recent studies that
Mm-hmm.
show that with calorie restriction, intermittent fasting, that
Mm.
night shift workers can maintain a healthy weight.
That's
This is the
awesome. That is so
most
good.
recent study.
Mm-hmm.
A few people, but it's out there. So I encourage people. I mean, what I do and works perfectly for me to manage my weight. I have a huge bowl. I make a big salad. Big salad. You know, it's a salad I can eat. I mean, I try to stop eating at least from like 1 a.m. midnight. I try to get into it fast.
Yeah.
But in this bowl, I have everything. It's a very healthy salad. It has my veggie. It has my crunchy, my carrots. It has my sweet, my apples. It has my chickpeas. It has my olives for my healthy oil. You know, it has a little cheese. Because what you need is you just need to feel full.
Yeah.
That's feeling of fullness, you know, that kind of tricks the brain, but you're not getting calories out of it. So that is how I do encourage people to, you know, who work nights to maintain, you know, in order to maintain healthy weight, you know, keep your blood sugar on the lower side and avoid diabetes. You just have to adjust how you eat.
Absolutely. I love that. And I think it's just about being intentional, because you have to think to your brain that your body is meant to be sleeping. So you wouldn't be eating pizza, hopefully, at 3 a.m. So you probably should not. But we don't want you starving. We don't want you going into a starved state, because if you're going, even if you're sleeping and you're going to bed hungry, you're going to wake up. So it's really finding that balance and limiting the high carbs and limiting the high sugars, but looking for healthier options. I love it. So that was number 2, right? We talked about sleep, we talked about food, and then the light exposure. And I realized that is tricky, especially if you're going home and you're meant to avoid too much bright light, right? Because you're going to go home to sleep. Where do we fit in outdoor time? Usually what I recommend is get home, get your initial block of sleep, and then try to go outside and, you know, get the exercise in there. And that way you can still take advantage of getting that natural vitamin D. If you need to take supplements, please do take supplements. But how do you recommend fitting in that light exposure and then, you know, of course, the exercise in this scenario where, you know, you're going to be going back to work for your, you know, your night shift the following night?
You know, I guess the biggest issue with night shift work is, you know, legislature. You know, the legislature out there is, I mean, they need to be reviewed, first of all. You know, they need to be revisited and updated, because I mean, I was reading a lot of, you know, articles leading up to this you know, conversation, and I read that, you know, the International Labor Organization, I think it is the night shift convention. I think that was in 1990. What they recommended, you know, what actually should happen when people work nights. Your employer should actually be involved in you know, evaluating and see when it's time to kind of switch you over to a daytime job. You know, they should actually, you know, check in with you and see how you're coping. So, and the reason why I say this is that there've been so many, you know, recommendations regarding how long people should work nights. You know, you shouldn't do more than 3 nights in a row. You shouldn't do more than 4 nights in a row. And maximum is actually 5 nights. You shouldn't do more than 12 hours shift 4 nights in a row. But we know that is not what is happening now. You know, I mean, I'm a hospitalist and a nocturnist. Some people do 7 nights and 8 nights, and it's crazy. It shouldn't happen. It should not happen. So, and the reason why I say this is that, you know, when people work 3 nights in a row, I mean, you can actually argue that, yes, they could do without sun exposure. I mean, maybe they're not going to like sit under the sun and bask in the sun and all that. But on the days they're off, they can catch up on that, because night shift is hard. That's why I keep saying that the recommendations and the reality
completely
are 2 different things.
Absolutely.
And that's where I come in, because, you know, when you're doing it, you know, the difficulties involved in it. And when you recommend it, you know, it may be difficult for a mother who is taking care of kids, and, you know, you drop them off at school, you want to just get to, you know, go get some sleep. And you maybe during the springtime, you can have your breakfast on the patio and get some sun, that kind of thing. So we can recommend that people maximize exposure when they can, but I think the focus is, you know, the nights you work to maximize sleep. The days you're off, sun exposure, you know, go all out and be as healthy as you can.
And then the fourth one, so we've talked about prioritizing sleep. Well, and for the sake of time, I'll just run through some of my tips and you'll let me know if
Yeah,
anything's missing. We've talked about focusing on light exposure and exercise. So getting it in, especially on those days that you are off, to try to get that in as much as possible. But you can still have some wiggle room. Like if you get back from your shift, you take your first, stretch of sleep, you can get out there, take a walk around the block, whatever it is, trying to get that light out. And then the final thing, which is what you said again and again, even from the moment we came here, is finding out once that why is resolved, try to get back on a regular shift, because all these things we're talking about are just like hacks and tips to try to get you the best, your healthiest possible self. But the healthiest version of you is sleeping at night when you're supposed to be, and
absolutely.
awake during the day. So when your why is done, where you are able to shift or able to advocate for yourself for a day job for the sake of your health and all the long-term consequences we talked about, ideally you want to shift back to a day shift job, right?
Yeah, but
Yeah,
that is absolutely true.
yeah,
I always like, working night is like a team effort. It's like
yeah,
a whole family works night.
yeah,
Your spouse, your family, your friends, and
yeah.
that's the first thing I tell people. People who work with me, tell people that you work at night. Tell your
Mm-hmm.
friends, tell your family, tell them you work nights, because when I give people like sleep, sleep health and tips on how to get restful sleep, the first thing I tell them is tell people you work at night.
Mm.
That is
Yeah,
the first step. Tell
yeah,
them so they don't call you. Tell them they don't come over. You tell your neighbors. You tell your landscaper, because I have my landscaper. He always comes the week I'm working. I had to like I said, please, I work on this
yeah.
week. Let's just move things around. You understand,
Mm-hmm.
And of course, people who do household chores, vacuuming and stuff like that, just tell them, put a sign outside, when you have delivery, drop it in front of the door. Don't ring the bell, that kind of thing. So this is the
Absolutely.
first step so that you can have uninterrupted sleep.
Yeah,
It's extremely very important, that you sleep well. Then in addition to the light blocking, the blue light, blocking sunglasses when you leave work, in the morning.
yeah.
And of course, the room, dark, quiet, you know,
Mm-hmm.
the curtains, the blackout
Absolutely.
curtain, the,
Mm-hmm.
the, the cooler temperature room. I like my room at 68 degrees. That's how
Mm-hmm.
I keep it kind of cool. Then I have my socks and my favorite pajamas. It's
Love
all
it.
routine. It's
Yeah,
routine and intentionality. That's what it is.
yeah, yeah.
Yeah.
So it sounds like you rounded this nicely with just the tips, the final tips, because we definitely want to get that in. Protect your sleep time. Make sure that you get the biggest, most bogus sunglasses that gets you home, so you're not exposing yourself to light right after your shift. Make sure that your family, if it's possible, the neighbors, where everybody is on board, that there's a shift worker here, so you can protect your sleep. And I love how you incorporate a routine. So it's not so much a night routine, more of a bedtime routine. And creating that routine that gets you sleeping the best you can, making sure that your room is as black as possible. There's a friend that I made on Instagram who they're called Blockout Light, and they have this it's almost like a cave,
Oh,
that
wow.
pops up, which definitely give her a follow. It's Blockout Light, and it's Z Den. It's called the Z Den, which I
Oh,
think is phenomenal for shift workers, because that way you're sure that you're sleeping in a room that's as dark as possible, because you want that darkness to promote sleep as long as possible. So those are just some tips before your shift, taking a nap just to promote
yeah,
alertness.
yeah.
And then, making sure if you can get to, especially if you have a longer shift, if you can get to take a nap during the shift, 20 minutes power nap at the earlier part of the shift, take advantage of that as well. Hope I didn't miss anything. I know I've held you longer than I intended, but if I did, please feel free to chime in, and then we could talk about where we could find you and work with you.
Yeah. So one thing I want to just, just chime in, before, we wrap up is it's very important. I mean, this is like a plea. I am just making this appeal. If you work nights, I mean, everybody, not just if you work nights. If you are an adult, just be on top of your regular health checkups. It's extremely very important, especially as a night person. As somebody who works night, you have a heightened risk. You have a higher risk of a lot of medical conditions, including cancer. So I encourage you to do your checkups, do all your age-appropriate cancer screening. And secondly, too, if you experience severe fatigue, if you find out that, or you feel like, you're having trouble sleeping when you get back from work, or you're very fatigued, you can't even drive home, you're getting into accidents, both at work and even, personal accidents, due to being so tired and fatigued, you should speak to your employer. You should speak to your primary care physician, your healthcare provider. You should bring this up because you should stop working nights. Maybe it's time to stop. I mean, whatever reason you work nights, your body is telling you that you can't continue. It's really very important that we listen to our body, to our bodies, and also, you got to be careful about your mood, mental health. Night shift workers, low dopamine, serotonin, and endorphins, and that is why when you exercise, it's a natural way to increase these hormones, and it helps you sleep, it helps your mood. But you just have to know your body. And of course, I got to talk about, your lifestyle. Do you smoke? Smoking may not be the best thing for you. I mean, for anybody, especially somebody who works at night, because of, the reasons that I had forementioned. And of course, alcohol. You have to limit your alcohol to the stipulated, quantity, which is 1 drink a day for women, and I think 2 for the man. And of course, you have to also think about, whether it's, caffeine. I know so many night shift workers, I mean, studies on caffeine is kind of conflicting, because now it was recently, they said it's good for your health, the caffeine is good for your health. But I mean, limit use of caffeine before sleep. You just, it's something that, could also, affect the quality of your sleep if you consume so much of it on your drive home. Because I mean, I have a commute back home, after work. So, but I know how much I need to drink to get home. I mean, I take like 4 ounces at 6 a.m. and that's it. And it gets me home. It clears my mind. And when I get home, I don't have a problem sleeping. And that's the importance of routine. As somebody who does work nights. Yeah. And,
so much to cover. Maybe we'll have you come back for part 2. One thing I was going to say is there is a condition called shift work sleep disorder, and that's what you described. If you're someone who is struggling with insomnia, where when it's time to sleep, you're unable to sleep, and you're struggling with alertness when it's time for you to work, and you're finding that you're profoundly sleepy, you have fatigue, you feel excessively tired, you should see a sleep specialist while you're speaking with your employer about potentially changing, because we do have some medications that have been approved for shift work sleep disorder. We may use a combination of medication called modafinil as well as melatonin. But before we even get into, again, these are just, ways to just get you through. I think the end or the ideal would be for you to be able to shift to a job that's better aligned with your circadian rhythm. Thank you so much. We definitely will have you come back next time. But in the meantime, can you just tell us where we can find you?
So, Dr. Yel'Ora, I am Dr. Yel'Ora. Dr. Yel'Ora. So you can find me. I mean, my website, I have a website that is very explanatory. It says everything I represent, and it's www.drYel'Ora, YELORA.com. So on this website, you can reach out to me if you want individual coaching or if you want group coaching. And I also want to work with companies. I want to work with corporations that hire night shift workers, because I think that hiring and maintaining your staff is pretty. It's difficult. I mean, we're going through difficult times. So when you can relate and provide for the needs of your night shift workers, I think you have better retention. And and also, I'm on Instagram as the Dusk to Dawn MD, Dr. Yel'Ora. You can find me there, and I'm on LinkedIn as Chinyelu Oraedu, Dr. Yel'Ora.
Awesome.
Yeah.
Wonderful. So definitely give Dusk to Dawn a follow. And you know me. If you don't, I'm Dr. Brown. I am the founder of Restful Sleep MD. And if you are that night shift worker who, you've done all the things and you're still feeling that excessive fatigue, difficulty sleeping, or you are having a hard time prioritizing your sleep, then definitely schedule a call and let's talk through what I could do to help you. We have the same similar passion and mission to help people prioritize sleep and prioritize their health. And I just really love the work you do. And I say thank you for doing this, really, and for helping so many people out there. And thank you everyone that's joined. I know some have stayed on through the entire talk, and we definitely have to have Dr. Yel'Ora come back so that we could do a part 2 and really get into the weeds of this.
Absolutely. Thank you. Thank you, Dr. Funke. Dr.
Oh,
Brown.
you're so welcome. All right, everyone. Take care. Bye.
Bye-bye.